So I think to one extent, the very early days of COVID, what we have done and built out an infrastructure of local well-being champions, internal portals to share a lot of contents, set up the technology for running sessions. But then we ran into the question of, yes, but we need to fill this in with content. And that's when we were, it's not a secret that we've reached out to external, support, global providers, local ones, to bring in experts and start supporting our communities to, on nutrition topics, breathing, postures, resilience, a wide range of topics. And surprisingly, in some extent, we ran into the limits of technology, because more people were interested in joining these sessions than we could allow. So there was a increasing number of sessions, day by day, week by week, and a lot of people attending. So that was number one, what we have done. Number two, moving into my specialist area, which is the healthcare support. At the year end, when we were renewing our policies, there were two critical aspects that we wanted to make sure that we incorporate to our new coverage. One is any possible access to digital content and digital knowledge about health issues, wellness, everything which is out there, and multinational, healthcare facility or healthcare providers pretty much were ready at the time to support that. The second one, which is employee assistance program. So we try to incorporate employee assistance program into our healthcare coverage for two reasons. One is extremely easy. We don't need to deal with the sourcing of it. That's the insurance company does it for us. But second, and probably foremost, is that once you go through an employee assistance program and something more significant issue is identified, which is beyond the limits of employee assistance program, then you can switch on to your medical coverage, assuming that you have psychologist to psychiatric coverage in your scheme. So that's a flow. Employees don't need to start from scratch, and we discuss the topics with the specialist. And that leads me to the third point, which I wanted to raise. Before COVID, when people were predominantly working from an office environment, having any kind of well-being issue was probably first observed by colleagues, line managers, people around the office. So employers had sort of the obligation, but the opportunity to train these colleagues, and to how to support such cases. Now, with the blended working environment, or in the past year, working from home, this role has actually shifted to the family members. So the spouses, all the kids who are old enough to observe certain behavioral changes, knowledgeable, etc. So what we try to achieve, and we are in very early stages of that one, is to reach out to the family members, to let them know that what resources we're providing for their EY working spouse, what services they can actually be covered, because EAP services does cover dependents. Medical insurance does cover them. So we want to engage them and make sure that they're equally aware of the opportunities that we provide for the for our employees. And I think that's one of the points that we can keep on discussing, and prompts another question: that how do we deal with the singles? Well, that's an interesting topic, and probably all of us can contribute. As yes, singles, they don't have the spouse and the family members at home to support them. I would assume that probably those will be the ones who will predominantly go back to an office environment. So then we're shifting back to the pre-COVID situation. These are the things that we need to balance out in the future.